My name's Claire Marshall. I'm Head of Patient Experience for Frimley Health NHS Foundation Trust. My role is to make sure that our patients are listened to, heard, and the results of the feedback make positive changes for service improvement in the organisation. The emergency department was nominated for the FFT award because of the changes that they've made over the last 2 years. Back in 2014, the department was rated as requires improvement by the CQC. The team really took that report and worked on making changes for service improvement for driving quality. They had about 7 to 10 complaints a month, and that has significantly reduced. They worked with both Healthwatch Bracknell Forest and Healthwatch Bucks to look at visiting the emergency department and understanding where they could make changes for improvement. They have also worked with a patient with long-term conditions to walk through the department to help them understand with a fresh eyes approach of where changes could be made.
My name is Karen Maskell. I'm a patient living with a rare condition, hereditary angioedema. I'm also the lay member for patient and public involvement for Bracknell and Ascot Clinical Commissioning Group. I had cause to come to the emergency department here 4 or 5 times when I was working in Slough. As those visits progressed, it got progressively worse to the stage where I actually refused to be taken in an ambulance to the A&E here. On the quality visits that I've been lucky to come along as in part of my lay member role, I have seen a real improvement over the last 2 years in the ability of the staff to make a change where they want to see it happen, passion to do the right thing based on the patient.
Hi, my name's Joanne Hawkes and I'm the matron for ED at Wexham Park Hospital. I run the emergency department along with James Rolfe. The improvements that we've made since we've had FFT in Wexham is that we've looked at those comments and we have taken them very seriously. We have brought in flow for patients. We have understood that patients didn't necessarily know what flow they were in, so we've given now more information out about that. We've put water in more places so people are able to get to it, including the waiting room. We've improved our food services at night. We've done some very basic building work such as stopped doors squeaking and told nursing staff not to wear clonky shoes. So we've done a lot of work around the comments that we had.
I'm Angela Ballard. I'm the head of nursing for A&E and acute medicine. I'm the professional lead for nurses for those areas. I think one of the biggest challenges was the engagement of staff and that actually involving everybody across the board. We set up a couple of focus groups which actually involved everybody from the admin staff, the porters, the healthcare assistants, the nurses and the doctors. And to begin with, people were a bit like, well, this isn't important to us. But once we started embedding the information and feeding it all back, the engagement actually grew.
There are a variety of ways that we use to collect our friends and family test surveys from patients. They can be paper, we use little cards, we also use text messaging. So the patients from our emergency department that leave mobile phones are sent a text message within 24 hours of discharge, and we can use that information to make the changes for the patients.
This is our patient safety and patient experience board. It's so that all members of the public can see it. What this shows is how we're doing with our cleaning audits, how we're doing with falls with our patients both in ED and in our overnight stay unit, how many people from the FFT would recommend us, any pressure ulcers that we might have been developed while in the emergency department. It shows an expectation that everyone should be saying who they are and what their name is when they first introduce themselves to a patient. It also gives us you said we did. So this is the information that we get from the FFT. So what we do is when we go through it, people would say things to us such as the waiting room needed more information in it, people didn't know what streams there was. So then what we've now done is a computer screen in the waiting room explaining that, and that's what this board explains, is basically what you've asked for, we've done.
I was so impressed by what I saw and I came on the quality visit that I felt it was important to tell my story, because I know that fear of not wanting to go to somewhere because you're afraid for your care, and I don't want anyone to ever have that feeling here, because the quality of care, the passion of the staff is evident in everything that they do.